it's likely to keep coming back, but I'll let Dr. Mariam introduce herself, and she can be the doctor for this one. You guys might be tired of seeing me. I'm not tired of seeing me. Yeah. Okay. So quickly. So you're speaking to me. I'm the father.
Okay.
Okay. Speaking to me, and I'm the father. And I'm going to get the timer going.
What's your name and what's the baby's name?
Yeah. So my name is John Smith, and the baby's name is. What's a baby name? What's a good baby name? Lily?
You can call Colin, Lily, whatever.
Colin.
Colin.
We'll go with Colin. No problem.
Colin, yeah.
Go with Colin. Child's name is Colin. I'm John Thomas. And that's Colin Thomas that you're dealing with. And Dr. G, already ahead of the game. Well done, Dr. G. So let's go for it. Hello.
All right. Huh? All right. Do let me know whenever you're ready with the timer. Yeah.
Enter the room.
Hello, good morning.
Hi.
My name is Dr. Mariam. I'm one of the junior doctors working in this department. Can you please confirm your full name?
Yeah, I'm John. I'm John Colin.
All right. And may I have sorry, can you do it again? Because the name was John Smith and the baby's name was Colin.
I'm so sorry.
Yeah, because I was like,
I messed that one up. Yeah. 3, 2, 1, begin.
All right. Hello, good morning. My name is Dr. Mariam. I'm one of the junior doctors working in this department. Can I please confirm your full name?
Yeah, I'm John Smith.
All right. And how are you related to Colin, please?
Oh, that's my son.
All
Colin
right,
Thomas.
okay. Okay, that's good to know. Can you please confirm Colin's full name and age for me?
Yes, Colin Smith, and little kid is 3 years old.
All right, okay. Okay, so what brings you here today?
Doctor, my child's been, my child got a rash 2 days ago, right?
All right, okay.
And it's really been worrying me.
I can see that you're really worried,
Yeah.
and I'm here to help you. In order for me to do that, I'll have to ask a few questions. Will that be okay?
Yeah, of course, of course.
All right, okay. So you told me that he's been having a rash for past 2 days, yeah?
Okay. It's not always there though. So
all right.
Yeah,
okay.
He had it 2 days ago. It went away, and then I think he got it today as well. I think he was playing outside and he got another rash.
All right. Okay.
Yeah, but he's got this rash, and we're really worried about this rash that keeps coming back.
Okay, all right. I'm gonna ask a few more questions in order to help you. Will that be fine?
Yeah, absolutely. Yeah.
Okay. So you mentioned to me about the rash. Where exactly is the rash?
It's like it comes like I've sent in a picture.
All right, I'll have a look into that as well.
Yeah.
Okay.
It's like, the lower rib areas.
Okay. And it comes always at this place.
At different places.
Okay.
Different places, yeah.
All right. Okay. And if I may ask you, what's the size generally of the rash?
I don't know. A couple centimeters.
All right.
Sometimes more than one. It's all red.
Okay. All right. And you mentioned to me it's red. So has it been changing the color as well?
No. It's the same, like pinkish red. It's probably pink, I'd say. Yeah.
Okay. All right. And you mentioned to me that happens after he played, right? So has it been happening every single time that he plays and he gets the rash?
No, last time it was after he took a shower.
All right. Okay. Okay.
Yeah.
So it's just 2 times that has been happening, yeah?
Yeah, so far. But, just been asking about, what the rash is and stuff.
All right.
I'm really worried.
And yeah, well, don't worry, I'll be able to help you, okay?
Okay.
So have you tried anything for that so far?
Nothing.
Nothing? And has there been anything else apart from the rash itself?
No, doctor, no.
All right. So I'm just gonna ask a few questions. They're might, seem a bit alarming. They're just yes or no questions. Will that be okay?
Yeah, sounds okay.
Okay. So has there been any itching with that?
No.
All right. Any bleeding?
No.
Any oozing of any discharge?
Not really, no.
Has it been painful?
No, but I think it's annoying him when it's there as well.
Oh, I see. I
Yeah,
see.
he
Okay.
keeps saying I'm hot. I feel hot. It's like
Mm-hmm.
I think it's a bit hot and stuff.
All right. Okay. And any fevers?
For the fever, no,
Okay. Any breathing difficulty?
no, not at all. No,
Okay. Any swelling around the nose, around the lips and tongue?
no, no swelling in the lips or tongue. No,
Any neck stiffness?
no, doctor.
All right. Okay, that's reassuring. And is he playing okay, eating, drinking well?
Yeah, yeah, he loves to play outside.
Okay.
The
Okay,
rash is
that's
not going to
good.
stop him, but
Okay. All
it
right.
keeps coming back, and I don't know.
Yeah. Yeah. Well, don't worry. We'll have a look into it and see what we can do. All right.
Okay, thank you.
Okay. No worries. It's just general questions. Okay now.
Yeah.
So has he got any medical conditions?
No, no, totally
Any
fine.
allergies?
I've never seen him react to anything.
Okay. Any family history of any medical illness?
No,
Does anyone around you or in the family has similar symptoms like he has?
not at all. No.
Any insect bites you might think of?
Insect bites. I don't think so.
All right, okay, all right. And also, just a few questions related to his general development. Are you happy with his development so far?
Yeah, absolutely. He's an active
Okay.
kid. He's very smart.
Oh, that's lovely. And how about the jabs? Is he updated with his jabs?
Yeah, we took him for all his immunizations. Yeah.
Okay, that's good. And was his birth uneventful?
Yeah, yeah. It was a normal vaginal delivery. Everything was
All
great.
right.
We were
All
really
right,
happy.
that's perfect. Thank you so much. Well, thank you so much for all these questions. Now I'd like to see at the picture, and ideally would have examined Colin. All
Yeah.
right.
Okay.
Okay, just give me a second, please.
Of course, of course.
Okay, thank you so much. So, is there anything in your mind that's been bothering you a lot with that?
Look, you hear things, you hear about
Mm-hmm.
meningitis. I'm really
Okay.
concerned that, this rash keeps coming back. And is it just going to
Okay.
continue coming back? Is that a problem?
All right, okay. Well, in order to make you understand a bit more about it and answer your concern, all
Yeah.
right, I'll be explaining you in a while. Will that be okay?
Yeah, yeah,
Yeah,
yeah, please.
yeah, all right. And if I may ask you, why are you particularly concerned about meningitis?
Yeah, the schools always talked about, we're looking
Mm-hmm.
at rashes and stuff, and they've asked us to see a doctor about this rash, and
Yeah, yeah. All
can't help
right.
but think.
All right. Okay. Okay. That's understandable. Being a parent myself, so
Yeah.
that's understandable. Okay. So from the fact that you told me that the rash appears after it appears and disappears and it comes after after playing or taking hot showers, and also the fact when I saw them they were raised red spots and they're in patches.
Hmm.
So all of this makes me suspect that it could be what we call as an urticaria.
Urticaria. What's that?
Okay, have you? Okay, so it's kind of an allergic reaction that
Oh,
happens when they're exposed to certain type of triggers. All
okay.
right.
Okay.
Okay. So, for your first concern to be meningitis, so fortunately, it's not meningitis so far. Okay.
Okay.
So that's the good news. The second thing is that you're really worried that is it going to come back again or not? Yeah.
Yeah, yeah.
So urticaria does come back again, but it could be avoided for the fact when you avoid the trigger, if I'm making
Oh,
any
I see.
sense.
I see. So we
So,
kind
yeah,
of have to find a trigger, yeah?
yeah, that's right. So the mainstay for this one is to able to find out the trigger.
Okay.
For now, what I can see is that playing outside and hot showers, and these are common triggers that's
Okay.
been happening, so you can avoid that.
Okay.
Okay. Apart from that, I'll be giving you a leaflet as well, explaining all the
Yeah.
other kind of triggers that are commonly seen in people, and they'll be able to help you. Okay.
Okay.
All
So
right.
just so I know, how does meningitis look like? What kind of
Yeah.
happens? How do I watch
All
out for?
right. So I was going to tell you as well because you need to be careful if the rash appears, and you need to be aware of some symptoms like a fever coming in with the rash or neck stiffness. That's
Okay.
generally a bit alarming for us and towards meningitis. So you'll have to rush to the GP, and or not, you can just call 999 and come to the emergency, okay? And we'll
Okay.
be able to help you.
Thank you.
And also, you told that Colin was a bit irritated because of this rash. So how about I might be giving you something called a calamine lotion if he's really irritated and itching. So that'll be able to help him. Yeah?
Yeah, thank you.
Okay, no worries. And we'll be following you up and call in 1 month's time. Will that be okay?
Yeah.
All right. Anything else you want to talk about? All right. Thank you.
I let you keep running because even I think that was 20 seconds over the timer, but the thing was silent, so it wasn't giving you the 2-minute warning. So I let it run. Finish the station. I think you did fantastically well. I think it was very clear that your history taking was covering all things, including anaphylaxis. It was including, symptoms that are systemic. And when those failed, and it was a rash that comes and goes, I think you did the right thing by making sure you kept it very brief and very focused, and you did the right thing there. Yeah. So for me, that was a definite pass. Safe doctor as well. Very clear explanations. Very good rapport building. You built a connection with the patient. You didn't ignore some of the things that could give you the chance to build rapport, and you did it. So it was a very good station there.
Thank you.
Yeah, thank you so much there. Appreciate that. I think you can be my patient for a few as well as I keep going. Yeah.
Sure.
Give me a second. Let me make sure this working. Yeah. So we are back at it again. Today has been all about simulations, all about looking at different things. And let's see what we have here. Should we offer a skin prick test? So it's looking like a heat urticaria at the moment. But when it's not very obvious, you can offer, testing for different allergens. It also depends on the severity of the allergens themselves. Yes, urticaria can sometimes cause itching and heat. And, when the person's dead itches, it exacerbates, and it can be warm, and antihistamines for children are not generally recommended, but calamine lotion does help with that, but it doesn't last for very long. We don't really want to offer children antihistamines either. So look at the severity. It's a very simple heat rash. The severity is not too bad. And so you're good to go. The next one here, right, is going to be something like this here. And I think we all know what that is, right? We all know what that is. That, my friends, is a seborrheic keratosis. And it's benign, okay? Now, a lot of the time, we may end up making unnecessary referrals. Yes. So this is the warning for this one. It is a very straightforward scenario, standard history. You will not find any risk factors that this could be a melanoma itself. It doesn't look like one, but the person could have risk factors like family history of cancer and sunbathing. Now, there are two schools of thought. One school of thought is that when there are risk factors in someone, what we must do is that we must tell them about the risk factors and explain to them when to urgently seek help. Another one is to routinely refer them for dermatoscopy, which is to have a look and make sure that there's nothing wrong, whilst all the time reassuring them that it is benign and unlikely to be anything major. It's a simple seborrheic keratosis. Whatever you decide to do, I need you guys to focus on the symptoms. That's what I need you guys to do. I need you guys to focus on the symptoms. If you focus on the symptoms, you're going to be fine. We've already done squamous cell cancers. We've done melanomas. What are the risk factors? Again, immunosuppression, having a comorbidity, such as rheumatoid arthritis, being on immunosuppressive medications, and, things like old age, 60 years old, and has bleeding and has, itching and a change in sensations, ulcerations, non-healing ulcers. If it's a melanoma, again, the same cancer risk factors of sun exposure. These you need to get, the smoking history and things like that. So don't worry too much. When something isn't changing, it hasn't changed, it has no symptoms, it's been looking like this, but, I've had it for 10 years and I'm just worried about it, then obviously you need to look into it. So I think we can go for the next one, keeping it nice and breathing easy. So here we've got a 40-year-old female. Okay. So Dr. Really and truly, it's been a long day. So let me take a sip of water here quickly. Dr. Mariam, will need you to be my patient.
Sure.
So once again, we're focusing on just, taking a rash history. That's what we're focusing on. We're focusing on taking a rash history. Same as always. Nice to see you again, Dr. Ninde, as well. And yeah, for this one, you can, I think we were going to have a discussion about Lyme.
Yeah.
And, so I'm going to choose to go through the guidelines for that one after this to explain Lyme in general and then to explain how you can recognize it. Yeah. Let's go. Timer. Oh my goodness.
Begin. Enter the room.
Hello.
Hi.
Hi, my name is Dr. Radwan Ali, and I'm one of the doctors here in the GP surgery. Can I know your full name and age, please?
Yeah, my name is Amy Brown and I'm 40 years of age.
Okay, nice to meet you. What can I call you today?
Nice to meet you too. You can call me Amy.
Okay, Amy. Very nice to meet you, Amy. How can I help? I understand you had a few concerns.
Yes, I've got this rash on my forearm.
You've got a rash on your forearm.
Yeah, so it's been there for a week and I was really concerned about it. What
1 week.
is it contagious or something like that?
Fair enough. Yeah, that's a good question. No problem.
Mhm.
You mentioned that you noticed the rash. Where is the rash exactly?
On the forearm.
It's on the forearm. Sorry about that.
Yeah.
You said that already, didn't you? Okay, no. Is it just one rash or is it more than one?
It's just one at the moment.
Okay, so it's just one rash at the moment. And can you tell me a bit about its color and shape?
Um, it's kind of a roundish. And it's increasing in size. It's reddish and a bit pale as well. Yeah.
Okay, so it's reddish as well. Right, okay, fair enough. And did the rash come on suddenly or gradually? I know you said you had it for a week.
Yeah, it was sudden. I think I just noticed it a week ago. I'm not sure though.
Yes, and you did mention that you felt it was getting a bit worse, isn't it?
Yeah, that's right.
Okay, can you tell me about symptoms? Did you have any symptoms before you developed the rash?
Oh yeah, so I had fever,
Okay,
3 days.
okay.
Um, yeah.
You had a fever. All right.
Mm-hmm.
Was it a high fever? Did you manage to measure it?
Um, well, it was not that high. I took paracetamol and it went
Okay.
away. But
Mhm.
yeah, I do feel like I'm having it as well at the moment, but I'm not
Fair
really
enough.
sure is it really high or not.
Fair enough. Fair enough. I'll have a look at
Hmm.
that and try to measure that as well. But
Sure.
any neck stiffness with that?
No,
Have you found yourself shying away from light?
no,
Okay. Any coughing, chest pain, or anything like that?
no, no,
Has you had any breathing problems at all?
no, no,
Okay. And have you noticed any rashes in your mouth or anywhere else?
no,
No. Okay. Any joint muscle aches or pains at all?
no, no,
Right. Any urinary problems at all?
no. I don't
Okay.
think so, no.
All right. Thank you so much for answering my questions. That's really helpful there. And the rash
Thank you.
itself, does it have any bleeding,
No,
any ulceration?
no.
Is it itching at all?
At times, but not really.
Okay. Has it blistered up in any way?
No.
Okay. Okay. And one more thing, you said it's getting worse and it's been increasing in size. What was the time frame in its increase? Did it increase over days or really fast over hours?
I think days, yeah.
Days. Yeah. Okay. And do you have any medical conditions at all?
No,
Okay. And are you on any regular medication or over the counter apart from the paracetamol?
no.
Okay. And are you allergic to any medications?
No, no,
Okay. Have you ever reacted to any antibiotics before?
no.
Okay. And has anyone in your family, or in your immediate vicinity household, has anyone developed similar symptoms of a rash?
No, no, I don't think so, no.
Okay. Have you traveled abroad recently?
Well, no, but then I went for camping just locally, yeah.
Okay.
So I went
Went camping.
camping.
Mhm.
Yeah, yeah.
Okay. The camping, how long were you out there for?
I think 5 days.
Okay. It was a
Yeah.
forested area or?
Yeah, it was way up
Okay.
the highlands, yeah.
I hope you had fun.
Yeah, it was lovely. Yeah, but
That's
then
good.
after that, I just got this rash and fever. So I
Mm.
thought it might be because of, being out there. But yeah.
Yes, I'm also thinking about the same thing, but
Hmm.
definitely you've had a fever there and you've got a rash, and I want to have a look at it as well, and we'll talk in
Yeah.
details about that. What do you do for a living?
So I'm a banker.
Okay, you're a banker, and how's everything in general, other than the rash?
Yeah, it's good. It's okay.
Okay, has anything woken you up at night while you sleep to do with the rash or any symptoms like the fever?
No, no, I think just the itching at times. That's it.
Okay, and do you have any idea as to what could be the cause of your? Have you
No,
given any thought?
no, no. I think I've heard about meningitis, but then I was really worried.
Okay, fair enough.
Yeah.
Fair enough. Okay. And I've asked you a few questions today. You haven't been shying away from light and your neck isn't feeling stiff. So that's definitely a good sign, firstly. Other
Okay.
than that, do you have any other concerns, or is there anything in particular you were hoping I can sort out for you today other than that?
No, just about the
Okay.
rash and thing.
All
Yeah.
right. Okay, then. So I'll just have a look at it quickly, if you don't mind.
Yeah,
Uh,
sure.
yeah, sure. Okay. But it's quite
Mm,
large in diameter, isn't it?
yeah.
Okay, I can see the redness there as well. Okay.
Hmm.
Thank you for allowing me to examine you and having a look. I'd also like to check your temperature, your vital signs, and your oxygen levels and things like that, if that's okay.
Hmm. Yeah.
So after examining you and having a look at the rash, I do suspect that what you could be having is called Lyme's disease. Have you by
What's
any
that?
chance ever heard of Lyme's disease?
No. What's that, doctor?
Um, it's caused by a tick bite, and it can really cause an infection and a fever like you've had, and sometimes it can
Okay.
affect other areas of your body as well.
Okay. So
Yeah.
is this something serious?
Well, if not treated, then yes. Yeah,
Oh,
because it can really affect the brain and the vessels, and it can really spread. But when it's treated, the outcome is really good.
2 minutes
okay.
remaining.
Okay, so we usually make a confirmed diagnosis by having a look, and it really looks like that. I want to refer
Hmm.
you to an infectious disease specialist as well, and
Okay.
send you for a special test known as an ELISA test as well.
Okay.
Okay, but moreover, I think it's important we start you on some antibiotics. The antibiotics you might need to take for up to 21 days. Okay.
Okay. Okay.
Yes. So in these situations, it is important I inform my immediate seniors here as well. Make sure that I get a second opinion because it is something that needs to be managed properly. I hope you understand.
Yeah. So do I have to stay at the hospital for the antibiotics?
You could take them orally.
Hmm.
You could usually take them orally. You have a fever, but there isn't anything stopping you from taking it orally. But the infectious disease specialist will be involved as well,
Okay.
and they'll really need to just do a few confirmatory tests. But it's really looking like that. It is basically confirmed
Okay.
based on the symptoms and how the rash
Okay.
looks. Okay.
Okay.
All
So where
right.
did I get this from?
Uh, you could have gotten it from the tick when you went camping. Yeah.
Oh, okay. That makes
Yeah.
sense
Did you
now.
remember
Yeah.
getting bitten at all?
Well, I don't actually.
Yeah.
I'm not
Sometimes you don't
sure.
feel the bites. Yeah. Sometimes you don't feel
Hmm.
the bites. But if you went camping and you were out there, it's a high chance you could.
Yeah.
Yeah.
Yeah. I'm not really
Yeah.
sure about that. Yeah.
Okay. So I'll make the urgent referral for you, and I'll take
Okay.
some opinion from my immediate seniors right now as well, and make sure that
Okay.
we give you a leaflet that you can read up on and information. Yeah.
Okay.
If you become
Okay.
worse, you develop any
Mm-hmm.
new symptoms, joint pains, eye symptoms, neck stiffness, please make sure that you seek immediate attention as well. Yeah.
Okay. All right.
Okay.
Yeah.
Okay then. Are there any other questions at all so far?
No, that's okay.
That's good. Okay then.
Thank you.
Station.
So literally on the dot, yeah?
Yeah.
8 minutes on the dot there. Turutu. So I think we looked through the guidelines for Lyme's.
Yeah,
I think one
sure.
of your colleagues, guys, mentioned that earlier was mentioning to us that they got the Lyme. And 1 week ago, I think the man was walking his dog. So let's have a look. Oh, one more time. You've seen it in action. Now let's see it live. All right. So there you go right there. So this is the algorithms that we have there for a quick revision. The full assessment So we usually take a history of the presenting problem, which is a fall or a collapse. Can you tell me more, right? Take the incident history before, during, after. Ask any collateral histories like dizziness, losing consciousness, biting the tongue, soiling and wetting. Afterwards, was there any confusion? Or was it the first time this has happened? And obviously the witness in this particular scenario was the husband. Any head injury, fainting. We covered all the bases. That's fantastic. We then move to the red flags. And when we're doing the red flags, what we're looking out for are fever, rash, neck stiffness. And if anything, I may have not asked about that. And the reason why is because obviously when they did their observations and their examinations, it didn't show any problems with that. So they did x-rays, they did ECG, they did all those things, and those came back normal apart from the tests. But in a situation where that's not the case, you do need to go for your red flags in there. Fever, rash, neck pain, the weight loss. Ask about, stroke signs and symptoms, which I did. Obviously, chest pain, breathing problems, and coughing. Also, you can suspect non-accidental injury. Okay, you can sometimes suspect it, right? When there's multiple falls, right? This was one fall. Ask more questions about non-accidental injuries if you suspect it, and rule out the causes of a fall, including CNS, CVS, and mechanical falls. So what's the trick to knowing it's a mechanical fall? The person could have had a stroke in the past, which left them with, weakness on the left side, and so they're tripping and they're slipping. And this is what a mechanical fall would look like. Other than that, multiple falls in the past is another thing. And then, for the scenarios where there might be abuse, it's really about recognizing the scenario outside. There could be a lot of other things. Oh, thank you very much. I'm glad you like the algorithms. They're all set. I think we're going to start rolling them out, definitely. And so they're ready to go as well. So I'm glad you like it, because yes, it's very straightforward in there. Your background history. What about them? Well, we're looking out for MAFTOSA. In MAFTOSA, I did tell you a lot about all of the other things earlier. We're signposting in there. We're thinking about general health. We're looking for any comorbidities, the allergies in there. For medications, ask general. Sometimes you're looking out for blood thinners and diuretics. Any changes in your medication recently is a good question to ask for changes recently in medications. Good. For family history of any conditions, that's straightforward. High blood pressure, high blood sugar, heart problems, what do you do for a living, and the usual. I think today, the one trend that I have a criticism for in myself is that I'm actually not spending enough time asking about drinking, smoking, alcohol, or recreational drugs. And I'm lucky for me, in those situations, it didn't seem like it was going to cost me too much. So, take it with a pinch of salt. We do need those. Smoking, alcohol, you get to move around. Hobbies, driving is important as well. So, make sure you do pick up on those areas as well. For your psychosocial effects, generally screening, how is everything in your life? How are things affecting you in any way? That's important. We usually like to use the communication tools. And so have you given any thought as to what could be going on? Do you have any specific particular worries? And is there anything you're expecting? Please, in these PLAB 2 stations, if you stay safe, if you stay friendly and you build rapport, that's the simplest way to build IPS, okay? Very, very easy. You don't have to be amazing. You don't have to be wow. You just have to be pleasant and polite. Other than that, stay professional. Examinations for fools, what are they? Yeah, so, what's the necessary IPS here? It's an older person, isn't it? So do you have a level of friendliness? Examinations and investigations, lying and standing BP were already done, but if it's not, you need to do. Also, check the visual acuity and listen to the heart, lungs, and things like that, and assessing the gait. So, part of the mobility assessment, you would see the gait when you ask them to get up and do and come back. Again, you can simply say, would it like to assess your mobility by, looking at how you walk and things like that, if that's okay. The blood tests, ECGs, all were done. Scan of the head was done. Urine sample earlier was done for the scenario. But if it's not done, you know what to do, right? And check the salt in the body, because that can cause falls through confusion and low sodium levels. Good. Let's explain the cause of the fall. So there could be multiple reasons, isn't it? So it could be increasing age muscle weakness. If the scenario is in that way, explain it. If it's, a medical reason, could be having a lot of medications that could be contributing. If it's mechanical reasons, I think that, the stroke you had a few years back has left you with some weakness, and it's really causing, for you to trip and things like that because of the weakness. But don't worry, we are definitely here to help. We will be doing further assessments, and there's treatment available, and the specific treatment depends on the cause. So in any case, falls usually need a full assessment at the clinic, okay, and full support, okay. And the relevant specialty is definitely physio and occupational. Yeah, physio and occupational. The medicine department is usually in charge of reviewing medications, and the physiotherapy is usually in charge of assessing mobility. So you hand it off like that. Somebody was asking, as an FY2, can I do that? Well, you can explain what's going to be done and just know that things will be done. But that's not necessarily a bad thing to say, this is what we intend to do. GP, okay? If you're in the hospital, then refer back to the GP for, or the full clinic. Sorry, yeah? You need to refer to the full clinic, as we said, full assessment clinic. In any case, how do we manage the concerns? Well, if the patient is worried about a stroke, you can let them know that, the stroke signs are 1, 2, 3, 4, 5, and that's also safety netting, okay? But generally, they might just be worried about getting better. And if, everything is normal, the x-ray is normal, then there's no problem. But when they have a fracture, they could tell you a bit about, if they're ever going to get better and things like that. The concerns in these stations are not too crazy. Mostly is being worried about strokes or being worried about things like that. For your leaflet, reading material on what to do. So I hope you've been enjoying the sessions today. Definitely, we have more algorithms to come, and we have the confusions to do as well. But we are reaching, obviously, the set parts. I think towards the end today, I'm also going to give you a quick jot down of maybe some of the newest scenarios, but we usually actually save those for masterclass, because right now it's about doing a scenario from beginning to end. So who's got a confusion scenario for me? And what could it be? So this is what we'll do, okay? Because obviously, one with dementia, daughter who's concerned. So Musarat, are you talking about palliative, end of life dementia? Yeah. Okay. Palliative end of life dementia, and then citalopram induced hyponatremic confusion. Those two are both coming up. No problem. We can do them. Palliative dementia will do. I would like 5 minutes to actually drink some water, go to the toilet, and then Mariam.
Yeah.
So you can be the daughter. You remember that one, huh?
Yeah, I do.
Isn't it?
Yeah.
Yeah, we can do no problem. I'll be the doctor.
All right, sure.
That one's high emotional.
Yeah, sure.
Yes.
No worries.
Okay, Musarat, she wasn't satisfied with your explanation. Fair enough. Okay, hopefully we can address that. I want to address that directly. No problem. Okay, so just give us 5 minutes. What time is it? 2:30. Okay, no problem. 2:30. We come back at 2.